I have a patient in my office with a negative ABI, but I suspect PAD. Should I still send him or her to you?
ABI, ankle brachial index. It's a good test. It's a good high-level screening test to help point you into the direction of yes PAD, no PAD. These days, historically ABI was a cumbersome test. It took 20-30 minutes. You had blood pressure cuffs. Someone had to be very highly trained to do it. These days, as I shoot this video in December 2021, there's a lot of newfangled sort of quick and easy mini ABI tests, if you will. There's QuantaFlow, there's FlowCheck, there's Smart ABI, there's quite a few. And these have pluses and minuses. The pluses are that they can be done very quickly, 5 minutes or less. They don't require any special training. And this is great, it's more convenient, right? You can screen more patients that way. The downside is, there's always a downside, right? There's no such thing as a free lunch. Their accuracy is slightly diminished, right? So they do have false positives and false negatives. It's not the end of the world, right? ABI is still a good test. It reimburses well. Most payers reimburse for it, CPT code 93922, and it's a good tool to use. However, we would not recommend that you use ABI to determine who you're going to refer to us or not. Do an ABI. See if it's positive or negative. Sure. Do not refer to us based on whether the ABI is positive or negative. Refer to us based on one of two things. Does the patient have wounds on the legs, ankle, or feet? Does the patient have leg pain? Without any other obvious cause. This is it. Wounds and/or leg pain are the primary criteria to point toward possible PAD and to refer to us. So, if you have a positive ABI, but you don't have wounds and the patient doesn't have leg pain, and they walk and 2 miles a day, they walk their dog and they don't have pain, they don't have PAD. It's going to be a false positive. Don't have to refer them to us. Or they certainly don't have severe PAD. Maybe they have mild PAD that you can medically manage and lifestyle manage. Conversely, ABI is negative, but the patient has a wound, hasn't healed, slowly healing. Or the patient has leg pain, either intermittent claudication or rest pain. Definitely refer them to us. So what I advise our referring physicians, we have many, and I'm grateful to them, is do not use ABI to decide who you refer to us. If you want to do ABI, do it. It's good extra information. It helps supports kind of the big clinical picture. But don't decide who you refer based on ABI results. Refer based on the presence of one or both wound and/or leg pain. ABI is an adjunct, just like there's secondary signs and symptoms of PAD. Hair loss, shiny skin, discoloration, coldness of the leg, ankle, feet. These are good symptoms, secondary, that also point toward PAD. But in and of themselves, they're not referral criteria. Wound and/or leg pain, regardless of what the ABI test shows.